Right, a warm welcome. We're 1 minute and 2 seconds away from Insights Live. I'm Reda Sadki from the Geneva Learning Foundation. I'm, of course, with Charlotte Mbou, also from the foundation, who's based in Ebolova, Cameroon. And within, let's see, the countdown within 48 seconds, we'll be going into, you'll be hearing firsthand from Teach to Reach 9 participants. If you don't know Teach to Reach, on 13th of October, this was the 9th edition, 17,662 participants, health professionals from all over the world who met to network, share experience, and learn from each other. You'll be hearing in less than 30 seconds, 1 month after Teach to Reach 9, what they've taken away and what they are doing with the new knowledge and the experiences that they heard at Teach to Reach. So that's what we're about to kick off. If this is your very first time listening to something from the Geneva Learning Foundation around Teach to Reach, a warm welcome to you, a warm welcome to everyone. Here we go. All right, Teach to Reach 9 was just about a month ago. We are now, today is the 10th of November. It's been a month. We're going to find out today what has happened since for Teach to Reach participants. We've invited those we call our guests of honor who contributed before or now after to Teach to Reach Connect. Really a unique opportunity for health professionals to meet, network, and learn together. We're going to kick off with Rebecca Bello from Nigeria and ask her to explain Teach to Reach in one sentence. Rebecca, a warm welcome to you. I hope your microphone is quickly going to be on. Yes. Don't forget to introduce yourself. Also tell us when you joined the movement for Immunization Agenda 2030, as Teach to Reach 9 was held under the banner of this movement for immunization. And then tell us, what is Teach to Reach? You need to do it in one sentence.
Okay, from University of Abuja, Department of Community Medicine, Nigeria. If I'm to explain Teach to Reach, okay, I joined the immunization agenda. I think I happened to be among the first set of alumni from Nigeria, the Geneva Learning Foundation alumni, actually. So I joined, I think when it was inaugurated, I can't even remember, but I know I was among the first set.
Yes, you were 7th of March, 2022. So what's
Yes.
Teach to Reach in one sentence,
Okay,
Rebecca?
yeah, 7th March. But I joined the Geneva Learning Foundation in 2020.
Yes.
So Teach to Reach, if I'm to explain in one sentence, is actually a practical learning through sharing and networking. A practical learning through sharing and networking.
All right.
That is if I'm to explain Teach to Reach.
That's great. All right. And now so on the 13th of October, you not only attended, but you contributed to Teach to Reach 9. You shared during a plenary session. So let's start with what surprised you, and then we'll ask you what you shared and what's happened since then. So first of all, what surprised you on the 13th of October in what you heard, what you read, what you thought about?
Yes, what surprises me, the surprise I got from Teach to Reach 9 was the support from participants on how to make sure that HPV is properly, the information concerning the HPV vaccine is properly given out to the different community. Every country, they tried their best to see that during the introduction of that HPV, every person is involved, not just one country, not just one region. So I am so surprised that it's a global thing, not just one particular region. That is for the surprise I received from Teach to Reach, because a lot of people share their own experience concerning the introduction of HPV vaccine in their countries and the rest. So I now told myself it's a global thing. It's not just one-sided. So
Listen.
I think then
all right.
for...
Yes, Rebecca. Yes, and then can you summarize for us, what did you share at Teach to Reach 9? I think it's important for you to summarize what you had a particularly compelling story to share. What was it?
Yes, I shared a story on female genital schistosomiasis, my experience And if I'm to explain in a short sentence, I would say it was a really challenging situation to see that a whole community, women are suffering from such a disease that I never thought would even exist in women. So I shared the story on how we were able to get to the community and we were able to carry out laboratory tests. We collected samples, we carried out laboratory tests, and the result came out, and we are on the process of the intervention, trying to see that those women, those teenage girls and women are going to receive proper treatment concerning that. So I'm even in the field trying to get some information and take it back for the doctor that is doing the research.
Now, this
So that was what I shared.
This may need a little bit of clarification for people who know. Originally, Teach to Reach, the conference started in January 2021 when immunization staff all over the world were getting ready to introduce COVID-19 vaccines. And so we've had a big immunization focus, but we expanded to a kind of one health approach, starting with Teach to Reach 6. And so as you'll see, you'll hear about climate change and health, about neglected needs of women's health, and other topics within Teach to Reach. Now, I just want to mark a pause to acknowledge, let me see, some of the folks who are following online. So we have Amos Aikwae Amavi, a public health tutor from Ghana, who's joining us. Amos, tell us if you attended Teach to Reach, what was most useful to you? If you didn't, what you would like, what you think, as you hear and follow this this session. David Fun Milayo, your district immunization officer from Nigeria. Same question to you. You can follow along and answer the questions. What surprised you at Teach to Reach 9? What session was most useful to you? How did it help you? And if you haven't attended yet, stay tuned, because we're going to tell you how you can connect now, today, for the next Teach to Reach 10. We'll be revealing the date and time and telling you more about it today. And then there's Gifty Akosua Adzigbe, a public health nurse from Ghana. Warm welcome to you, Gifty. Let us know. You can follow along and answer the questions. You're all following on YouTube. You may also be on Facebook, LinkedIn, Twitter, wherever you are. A warm welcome to you. And back to you, Charlotte. I believe we're going to hear from Mary Goretti Otieno, but I see other microphones unmuted. Oh. All right. Charlotte may herself be having difficulties. Yeah. So let's go to Mary Goretti. And Mary Goretti seems to be gone from the room. We'll also try.
She's actually unmuted already. Mary Goretti is unmuted already.
Okay, a warm welcome to you, Mary Goretti. So you have the questions. Can you take a stab at explaining Teach to Reach in one sentence and then telling us what surprised you at Teach to Reach 9? But first, do introduce yourself and remind us when you joined the movement for Immunization Agenda 2030.
Thank you so much, Dr. Reda. We are the pioneers, so we are the first Geneva Learning Foundation 20 to finish.
All right, Mary Goretti, it sounds like you're having connectivity issues.
Yeah. Experiences, he said at the beginning.
Unfortunately, Mary Goretti, you're fading in and out. Let's try one last time. It might be your microphone, so please make sure you speak loudly and directly into your microphone. Otherwise, I invite you to share share in the chat your contribution.
Thank you. I'm saying I'm Mary Goretti Akinyi from the University of Nairobi, Kenya. I joined the Geneva Learning Foundation in the year 2020, just at the beginning of COVID-19. We are the first alumni. And when Teach to Reach was introduced, we had a chance to share our experiences based on the ideas we generated at the beginning from the engine. And what has surprised me most is that we are the same, especially those from the hard-hit areas like the pastoral communities, where the immunization agenda had not been taken effectively. But with the sharing and all that, and the creating awareness picked from the ideas engine, we've been able to move the agenda. So Teach to Reach is a very rich platform where we share experiences, those in the academia, those in practice. We share a lot. And another thing which came to my attention is that men from Japan know where the clinic cards are for their children, as opposed to men from other parts of the world. So that one really encouraged me a lot. And I would ask us that when you talk about gender, we all need to embrace the issue of health, both men and women in the family. Thank you very much.
Thank you very much indeed, Margaretti Otieno from Kenya. So you've seen this number before, 17,662, and that's the number of health professionals who were registered for Teach to Reach 9 on the 13th of October 23. Now, this number is so big that some people, some of our partners even, who know the work that we're doing, say it's too good to be true. How can you have this many people? Where are they? Yes, and then come to realize, come to look at the data, come to look at what the outputs of this amazing community, and realize that yes, indeed, there were nearly 10,000 Anglophones who contributed to Teach to Reach 9, and who are continuing to contribute in the follow-up to Teach to Reach 9. Now, we say every time that it's about the connections you make with each other, but it's important to understand that the 13th of October may be in some ways the least important part of Teach to Reach. There's what happens before, and those of you who are here in the studio with us were selected and invited because you answered questions by email to share your experience, really contributing to Teach to Reach 9, helping us select the themes and develop the event so that it meets your needs, because we do it with you. It doesn't make any sense without you. And what happens after Teach to Reach is also quite important. We ask you to share your learning, insights, and reflections. And here you will see, out of this massive number of attendees, of participants, 17,762, we had a grand total of 1,817 who shared experiences before and after Teach to Reach. This is a remarkable number of health professionals going above and beyond. You did not need to contribute to share your experience, and you did actually over 800 Anglophones who did so either before or after Teach to Reach. Now, what comes out of this? I'm pleased to show you the cover of the compendium of shared experiences that will be issued within a few days. And here we have, for those of you who are interested in the details, the sample description. This really tells you for each of the questions that we ask how many contributions were received in English, how many contributions were received in French, and then you'll be able to go through really slide by slide, story by story, look at the themes that you're interested in, and dig in, deep dive if you wish to, into the individual experiences that are shared. So that is to give you a brief overview, and this new number that now that we've compiled and prepared this compendium of shared experiences. Now we're going to refresh your memory of the topics: Manifesto for Health 2.0, women who deliver vaccines, measles outbreak response, HPV vaccination, climate and health, neglected needs of women's health. These were sessions at Teach to Reach 9 held in plenary. We're going to ask you now, which session was most useful to you? How did it help you? We're going to go to, I see Sana Fati's microphone is unmuted. Charlotte, over to you.
Sana Fati, your mic is unmuted. Your hand was raised. Please, can you go ahead and introduce yourself and answer the question? Which session was most useful to you at Teach to Reach Connect 9?
Right.
I see Sana.
Yes, that's gone. This happens, and this happens every session. We really ask you, especially when you're a guest of honor for Teach to Reach, to really focus. Make sure check your equipment, make sure your connection. You've got the best connectivity that you have. Make sure your microphone is working. I'm trying to reach Udoji Danjuma Makoshi, who had expressed interest in speaking, in being one of the first to speak today. I see Mariama Idris, a leader in the movement for immunization for Immunization Agenda 2030. Mariama, you were at Teach to Reach 9. Remind us who you are, what you do, and then tell us of the different sessions, what was most useful to you, and how did it help you?
Thank you, sir. Thank you, sir. Hello.
Yes, we hear you loud and clear. Please go ahead.
Thank you, sir. Hello, good afternoon, good morning, wherever you may be. My name is Mariam Idris from Kano State. I'm a community health worker. I'm happy to be here, and I want to tell you my experience during this Teach to Reach 9th that we've just finished, and it's still ongoing. I'm so happy I joined. I have opportunity to listen to FGS program, though I've been hearing about it in this platform, but I've not been so much interested in this FGS. But when I take my time to go through it, and I've listened to some colleagues like Rebecca Bello from Abuja. So here up north, a man is entitled to marry more than one wife. They have 2 wives, 3 wives, 4 wives. That is the practice. So this gives me the opportunity when I go into the community to express my feelings to the women, married women, and the younger ones that are, married much more early, and they are having rivals. I mean, she's not the only wife of the husband. I try to explain to them, should in case they come across the FGS, that they should report to the appropriate area to take proper action, so that it will not lead them to having cancer of the cervix. And this really helped a lot. Thank you. This is my experience during this Teach to Reach 9. I'm very grateful. Over to you, sir.
Thank you very much indeed, Mariama. So let's now go to, let's try Udoji Danjuma Makoshi again. Udoji, are you ready to speak at this stage? I know you had your microphone working before, and we ask all of you, if you are a leader of Teach to Reach, if you've been recognized as a guest of honor and a contributor, please do your best to make sure your equipment is working properly. All right, let's go then to, let's try Dr. Bala. We went to him before, as well as Joseph Ngugi from Kenya. So Dr. Bala, Joseph Ngugi, up to you. We'll also try from Pakistan, Rizwan Ahmed, with these questions. So please, if you are, we're eager to hear from you about which session of Teach to Reach was most useful to you. Charlotte, I'm going to give you a minute and just continue to sort of revisit what we shared experience about during Teach to Reach. So we had, of course, the Manifesto for Global Health. And again, just interrupt me as soon as we've got someone on the line who's managed to get everything working so we can hear their voice. We've got the Manifesto for Global Health. So we presented what we call version 2. It's an open source document. We had over 1,300 health professionals from all over the world contribute to drafting this manifesto. Women who deliver vaccines had a very strong presence, and once again opened the Teach to Reach 9 with a session on HPV vaccination. I think we heard references to that session. All right, I see now Gifty Akosua Adzigbe has unmuted her microphone. Gifty, are you ready to speak?
Yes.
All right, wonderful. Remind us who you are, where you work, what you do, and then tell us of the different Teach to Reach sessions. What surprised you in Teach to Reach 9? What session was most useful to you? How is this helping you in your work? I believe for immunization, but potentially also for other areas.
Okay, thank you. My name is Gifty Aikosi Ajigbe. I'm from Ghana, public health nurse, and also a sign language interpreter. So I work in the deaf community precisely. Okay, so I can't remember everything, but I know it was it was March 7th, I think in 2021, if I'm right. that I joined the Geneva Learning Foundation. That is the Immunization Agenda 2030. And I had opportunity to network with other professionals from other countries. I happened to join the Ideas Engine, and it was just so eye-opening and so interactive, because well on the field we're doing a lot of things. We're doing our best just to hit the target, that is to ensure every child is vaccinated, but there were lapses. And joining this Geneva Learning Foundation, the AI 2030, has been so helpful, where I got to learn how to engage stakeholders, where I got to know that I need to network with other people, where they could share their experiences on how they are able to manage vaccine hesitancy. That really helped a lot. And so working in the deaf community, when I tapped into that idea, I was able to help explain and to educate my deaf community, people with disability, to be able to understand that despite they having this challenge, doesn't mean that when they take the vaccine, they are going to have other disabilities, because that was their fear. So I would say for me, the sharing of experiences and also the Ideas Engine has really helped me a lot. And what surprised me most was that when we say women who deliver vaccine, sometimes we think it is just for we, the younger ones. But during the plenary session, you realize that some people are old, some even on pension. But for the love and the passion for the work, they are still volunteering to still help. Then what is preventing me, young, from doing that? So going far and near to ensure that every child has been vaccinated, I got all that from women who deliver vaccine. For Teach to Reach 9, this recently ended. I was not able to join because I was not fine, but then I played the recordings. And I happened to listen to Professor Oma from Nigeria, who said she worked with UNICEF, and that how she was able to convince or educate the public, especially the adolescents group, for the HPV vaccine, because most of them were thinking it was family planning. Yes, I learned a lot, because it is not easy when we go to the school even to give tetanus, diphtheria for these adolescent girls. What we hear parents say, some even come to our homes to even attack us. They say we are giving them family planning commodities, and we are rather making them promiscuous. Meanwhile, it is not like that. So when she said she was able to educate or to able to help break everything all about the HIV vaccine to them, to be able to understand and to be convinced that it is not family planning, and that also helped her to be able to reduce the vaccine hesitancy, and then they were able to start the immunization, being it in church, the mosque and co. I was like, wow. So I really tapped a lot from her. Yes.
Wonderful, thank you. Great. So we have a question. Think about one specific idea that you learned at Teach to Reach, and you're hearing some of the initial responses. Now, Gifty, I saw you also on YouTube before joining here. Just want to acknowledge a few of the people who are connecting via social media, because this Insights Live is being broadcast right now across YouTube, Facebook, Twitter, LinkedIn. I think it even goes out on something called Twitch. So hello to Dr. George Kwaku Darko, who's a medical lab scientist in Ghana. Dr. George, tell us what you gained from Teach to Reach, one specific idea that you learned. We're receiving your comments. There's a little bit of a delay, but don't hesitate to share with us if you're watching from one of the platforms. Lilian Mutua says, okay, I guess this is the Teach to Reach question. What is Teach to Reach in one sentence? A platform where knowledge and experience is shared globally to improve quality of health. All right, I see there's more. Good day to all. Caroline Akosile from Nigeria. Adesoji Odukoya also from Nigeria. And Niyama Jata. So don't just say hello. You are a midwife, a registered nurse, Niyama. Tell us how these issues that were discussed at Teach to Reach were of interest to you. If you missed it on the 13th of October, I'd like to orient and encourage you to look at to find the YouTube channel of the Geneva Learning Foundation, because you can find all of the sessions from Teach to Reach, and I have a very special announcement I'll be making in a little bit about that. So that's a little bit from the social networks where we have many people watching. Back to you, Charlotte. Who shall we hear from next? Okay, now I see we have many microphones unmuted.
Yeah, Reda. So, in respect of our rules of fairness, I'll just ask Fanny to be patient while we try to listen to Anthony Lotukoi. Anthony?
Yeah. I don't know whether you guys can hear me.
Loud and clear.
Anthony
Yes,
Lotukoi. Yeah, this is Anthony Lotukoi. I'm a nursing practitioner currently working in Mogadishu, but originally from Kenya. I think what I enjoyed, or what I enjoyed especially during the Teach to Reach 9, is basically the experiences and the experiences that all the people got to learn. And for me, what was most interesting especially was for the HPV. Coming from the northern part of Kenya, where we have pastoralist communities who hold their culture dearly, and in a community where illiteracy is at the rate of around 86% in the communities, implementing interventions such as the HPV vaccines was quite tough for us as healthcare workers, because of what has been mentioned. Some people are thinking it was for family planning. It was a government effort, for example, to ensure that we limit the number of children that their families are having. So we sat down as healthcare workers, as other implementers, NGOs, and basically design a strategy on how we can address the barrier, so that at least our people also get to utilize this very important intervention. And I think what we did was basically talking to the gatekeepers at the community level, going to the basics of cervical cancer, trying to tell them, teaching them ways of preventing it, and coming up to the level of now the HPV vaccine. And I think by the end of 2022, the communities were really now coming and utilizing this very important intervention. And at the Teach to Reach 9, basically, when people were sharing, it just made me happy, because I could understand where they were coming from and the interventions that they were trying to ensure that at least more people get to utilize this important commodity. So I think for me, Teach to Reach 9 was all about learning and hearing from the experiences from people around the world, which was really interesting. And it's just it just highlights the commitment that we as healthcare workers put into ensuring that our communities get to utilize these interventions. And basically we are increasing the immunization coverage, and later we are making our community have the herd immunity which we require. Thank you very much.
Great. Thank you very much indeed, Anthony Lutokoi. Now, let's go to Aisha Kadai. Aisha, are you able to speak to us? And actually, Charlotte, I had invited Fanny because when we heard this reference to people, to health professionals who may be retired, who may be of a certain age, and who are still very active advocates for immunization, I immediately thought of Fanny. So maybe after Aisha, we'll go to Fanny. And there are a number of elders in the Teach to Reach community that we wish to honor. So I was really pleased to hear that. Aisha, are you able to speak to us now? All right. It sounds like Aisha is having problems with her connectivity. So let's try Fanny. Fanny, are you there? Are you able to speak to us?
Yes, I am here. Thank you very much.
Right. When you hear this young
Fanny
woman,
Ugu. Are you hearing me?
Yes, when you hear this young woman health professional talk about how powerful it was for her to hear elders like yourself speak about their continued commitment and advocacy for immunization, for equity in health, how does that make you feel? What would you like to say back to her?
It makes me feel great. I feel motivated, and I feel that the younger ones are willing to learn from the experiences of the older generations that are not wavering, still have so much to offer. Makes me feel good.
All right. And Fanny, so now,
Right.
what surprised you at Teach to Reach 9? And just remind us who you are, I believe,
Okay.
yeah, and where you work.
Okay,
Where
I'm
you used to
Fanny
work.
Ogu. I'm a nurse epidemiologist. I retired from Federal Ministry of Health, Assistant Director, Nursing Services, but currently an independent immunization volunteer. What surprised me in Teach to Reach 9 is the renewed zeal for immunization services and immunization programming, the consciousness of our interconnectedness in the evolving global community. And this brings to bear the realization of preventive health that rides on the wheels of immunization. That's what surprised me.
Very interesting, Fanny. And what's your perspective on the on how the HPV vaccination is developing, is being sort of rolled out through campaigns across Nigeria, and in particular where you are still very much active?
All right. As per HPV vaccination, it has started, but Nigeria being a very large country, some states were marked for the first phase, which happens to just be 16 states. That is less than half of the countryside. So those states have already commenced operations. They started with creation of awareness, going to schools. There are campaigns everywhere trying to sensitize the public about the benefits of HPV vaccination for children between the ages, girl children between the ages of 9 and 14 for those states. Since on the 24th of October, they have commenced operations. But surprisingly, the challenge we are facing as this is taking off is misinformation on the social media. The anti-vaxxers are on it again, trying to discourage people from taking the vaccination, addressing them specifically that this vaccine will cause sterility and is a means of contraceptives for the girl child, that women and fathers should not give consent. So the real area that we are looking at now, which I have tried to contact some key persons in Ministry of Health to find a way of arresting this misinformation, because if it is allowed to fetter, the remaining states that are yet to key into this program will be negatively affected. Thank you.
Thank you very much, Fanny Ogu from Nigeria. Now, we are going to mark a pause. We are actually over time, believe it or not, so I need to ask those of you who are in the Zoom studio with us, as well as those of you who are on social media, the following question. Should we close this session, or should we continue to hear more voices of Teach to Reach 9 participants, to hear what you have been doing in the month since and how you are using the experiences that were shared, the knowledge that you gained, the insights that you gained? So if you would like to continue this Insights Live session, type yes into the chat. If you would like to stop here, and of course, if you need to return to your daily duties, please do so. Then you are free to go. You can type no and go. Esa Jama says yes. Usman Mohammed Tukur says yes. Anu Luwapo. Raji Philip says yes. Maria Fernanda Manzan. Kingsley Niniere. Anthony Lutukoy. Swundo Gratitude. Linda Isaac Asia. Sabine Ndayo Iwat. All right, I think the eyes have it. So we're now, as we said, there are contributors to Teach to Reach 9, and there are 1,000, actually let's start here, 1,817 of them who shared experiences either before or after Teach to Reach. We're going to honor them now. However, briefly, we do not have, there's simply obviously too many to read the individual names. So what we're going to do is we're just going to scroll through the names in order to get a sense of what is actually here. Yes. So don't panic if you don't see a name. It is here. Here we go. So these are the names of the Teach to Reach 9 participants, health professionals who went above and beyond. There's no, you did not have to. Your boss did not ask you, your Ministry of Health did not ask you to share your experience for Teach to Reach, and yet you did. We believe this is something remarkable, reveals intrinsic motivation, and is something that we wish to honor and recognize. So here we go. And again. Now that is a list of contributors before Teach to Reach. And now we go to the contributions received following Teach to Reach. You'll recognize some names, of course, appear twice. Many of you were diligent enough to contribute both before and after Teach to Reach. Here we go. Alright, and I think we should make it a practice to read the name of the last person, which is in alphabetical order by first names, Yola Khan Surani. Congratulations to you. And again, 1,817 contributions. And again, a far larger number of people who participate, but we wish to especially recognize and honor those of you who take the time to share in writing your experiences, your insights, your reflections. We are about to publish the compendium of experiences of Teach to Reach participants, and that is where we'll formally recognize and honor you. So now that the assembly, those who are with us in our Zoom studio, who are in fact amongst those contributors, we call you the guests of honor. We want to ask you about, for those of you who networked, who did you meet and what did you discuss? And then also to share a story that you heard at Teach to Reach, whether in a plenary session or in a in a private networking session that had an impact for you. And it looks like Charlotte has already... Okay, are we going to try Aisha Kadai again, Charlotte?
Yes, Reda.
All right, Aisha, are you there? I hope that you've managed to work out your connectivity issues. Okay.
If not, I'm also inviting Esa Jama. You have been very active from Somaliland, kind of like bringing in some geographical balance.
Oh. Hello, good afternoon, everyone.
Hello,
Good
Aisha Kadai.
Aisha.
Yeah, thank you, Lida. Thank you, Charlotte. It's been a while. So actually, I joined the Teach to Reach in 2019.
Oh, wow. Welcome back.
Yeah. And one thing that amazes me with Teach to Reach is they are always active.
Uh-oh. Did we just lose
Aisha?
Yes.
Okay. Are you still there? Please, can you introduce yourself?
All right, I think we lost her, Charlotte. That was it. She was off to a great start.
That was never bringing people together all over the world. Hi, am I audible?
No, unfortunately, you were cut off for about 15 seconds. We can try again, but let's again. I would ask if you are invited as a guest of honor to a session like this one. Check your equipment before you connect. We'd love to hear your voice, and we hate it when one of you, such as Aisha, obviously has very interesting things to say, but doesn't have, something goes wrong. And it will happen, it's part of life, but please make every effort you can. Aisha, let's try again.
Hi, Charlotte. I'm back. Sorry, the network is fluctuating from my side. Hi.
Okay, hi, Aisha, please introduce yourself.
Yeah, I'm unmuted. Can you hear me?
Yes, we can hear you. Please introduce yourself.
Oh, sorry. Yeah. My name is Dr. Aisha Kadei. I work with WHO and I'm deeply involved in routine immunization activities because I used to conduct community survey house to house to look at their RI cards, tracking of defaulters. Like today, I met a woman. I was almost so intense to make a video clip of her. She was carrying a 14-month-old baby over a year, and she said she never gave him any form of vaccination. I was surprised, and that was her 8th child. I said, how about the 7 children you left behind? She said she has been taking RI, but I don't know how true it is since I've not seen the card. I just met her on the way because currently we are having a polio campaign. So I used to assist in support in mobilization of the caregivers to the vaccination sites and the rest. So I now drove her to the vaccination site and she took the polio vaccine. So I got her phone number that she should have to come to the health facility for RI on Monday. So these are some of the things which Teach to Reach has pushed me, and then I developed interest in it actually. Tracking of defaulters. I find it very interesting because we are still experiencing outbreaks of vaccine preventable disease in this part of the country here in Borno State, Maiduguri, Nigeria. So this is the little I have, but Teach to Reach 9 also I attended the HPV vaccination session where I had colleagues from Kano speaking about the rollout of the HPV vaccination and some few misinformation that has started coming up. So thank you very much. Thank you, Charlotte. Thank you, Rita.
Thank you very much indeed, Aisha. And as we said, welcome back as you were previously in Teach to Reach sessions. You said quite a long time ago. Essa Jama, is Essa Jama our next contributor? Essa.
Okay. Good afternoon, good morning, good evening, all. My name is Dr. Issa Chama. I work at the borders. I've been working MSF for the last 30 years. I work in the Pacific, West Africa, North Africa, Middle East, and also in East Africa. I've been a member for this platform since 2022. One of the most interesting network I learned from is immunization coverage. The good thing I learned from my last mission, I just finished in Nigeria recently, 1 week before from Cross River State or River State. The good thing is HPV and genital schistosomiasis from the other colleagues. What I am good is the networking. I have so much network and I learn from them. And then one of the interesting things is climate change and the cholera interventions that I learned from this Teach to Reach 9. The good thing I have so much social network. Whatever I learn from I network, I share with others, so others will join the other sessions. Thank you.
Thank you, Essa Jama. So a couple of questions for you. We've seen you very active on social media. Can you tell us, and so just a clarification, the oral cholera vaccine, that was a topic of discussion at Teach to Reach 8. So it's good to see over time, that if you could tell us more about what you learned from that around oral cholera vaccine through the sharing of experience from your colleagues. Can you tell us something about that? If you are, and then also tell us when was the last time you were involved in a cholera outbreak response?
The last time a cholera response was in April and May. We respond in the southern part of Nigeria, called Cross River State. And then in June and July, we respond to oral cholera vaccine. The courses I learned from here and the one where I collaborate with WHO Minister of Health Cross River State, it completely helps me how to implement oral cholera vaccination and the specification, the technical working groups, and as well micro planning.
So let me ask you this. Obviously, if you're a member of those technical working groups, if you're looking at, you're referring to, I'm sure, the WHO guidelines and other sort of technical guidance on the topic. What does it add? How is it helpful to you to then hear people sharing their experiences of what they actually did and carried out when using OCV or oral cholera vaccine? How is it helpful to get experiences shared, and how does it complement the guidelines and technical working groups and so on for you?
Excellent. It helps a lot because when we were doing for the sessions of advocacy, community sensitization, as well as training for health workers and vaccinators, this helps me a lot because we are using the protocols, the guidelines, and the lessons learned from the OCV before than other countries. Thank you.
All right, thank you very much indeed, Essa, Jama. And one more question to you: were you able to network at Teach to Reach 9?
Yes, I do, and I wrote my HB the climate change, the immunization agendas, and I'm active on I'm leading the programs, and my program is also leading for EPI for tackling measles vaccination coverage, and I always deploy for areas which have a low access and low access or
I think
minimum coverage for vaccination.
Let me clarify my question. There may be a confusion. So during Teach to Reach 9, there are opportunities to do one-to-one networking where you press on the button and you talk to somebody individually. Were you able to do that at Teach to Reach? And
yes,
if so,
yes, I do a lot of colleagues from Nigeria, and Gambia, Senegal. I can a lot of people. We learn each other, our names, what we do, what they do as well. We learn, we share our knowledge each other. What I do, what they do, what kind of activities they do. It was real interesting.
Okay, very interesting. Yeah, because we think of networking as being really the heart and soul of Teach to Reach. So if you are in our studio or online on social media and you have a story to share, a Teach to Reach story, something that you heard, something that you did, somebody you spoke to that had an impact on you, on your work, please do let us know. We have a few minutes left in this discussion. Thank you very much indeed, Essa, Jama. And back to you, Charlotte, for our next speaker.
Thank you, Reda. I think we need to go towards Asia. That is why I'm inviting Dr. Khalid Hussain, whose hand is raised to unmute, from Pakistan. Dr. Khalid Hussain, and do introduce yourself. Tell us who you are, where you work, but most especially if you participated at Teach to Reach 9. What did you learn? What did you find useful? So are you able to unmute? I'm asking you to unmute.
And yes,
if not, I'll turn to Kingsley Nyere, Reda.
Yes.
Oh. Kingsley unmuted himself and got muted. Kingsley, please go ahead.
Okay, thank you very much. I'm Kingsley Kofi Nyere. I work with Community Youth Development Foundation, based in Ghana, specifically Kintampo in the Bono East region. Yes, I've learned something very important during Teach to Reach Connect 9. That has to do with the zero dose. I remember the guide on our site mentioned that when we are identifying zero dose children, we shouldn't neglect people who are closer to the health facilities and also people that we consider they are academically inclined. Hence, maybe they know something about immunization and they may like to pick their children for immunization. In fact, during Teach to Reach Connect 9, this particular idea has changed my perception. Why am I saying so? Because I perceive people who are closer to health facilities, for them they can even walk to the facility for immunization. And people who are highly inclined in terms of education to, they too have much idea with regards to immunization. But the guide on the side made me to know that there are people who are academically inclined, people who are closer to the health facilities, but they are still not going there for immunization. So we should map up to those people so that we can catch up for we can catch up with the zero dose immunization. It has actually helped me so much to identify people within Kintampo municipality. I think that was the specific idea that I picked from that particular zero dose immunization. Coupled with that, another participant mentioned of the HPV vaccine in their country, the way they engage the stakeholders such as the Minister of Gender and Social Protections, they engage the Minister of Education, and it has actually helped them a lot in doing the sensitization and also vaccinated people who were supposed to be vaccinated in
I think we just lost Kingsley. Charlotte, can you still hear him?
No, Reda, I think so too.
All right, but I think we got
Kingsley,
the main
country, that is Nigeria.
All right, thank you. So yes, and I encourage you. So we'll soon be sharing with all Teach to Reach participants a series of really stories about the impact of the movement for immunization agenda 2030. Kingsley, who is just sharing what he gained from this latest Teach to Reach, there's an entire case study telling the story of how he was able to improve both malaria vaccine coverage, so malaria vaccine introduction, combined with in an integrated way with COVID-19 vaccine. And he's one of many, actually hundreds of leaders who are reporting this kind of impact. I believe, so I'm sorry we couldn't hear the last part of Kingsley's. Kingsley, I encourage you to share in the chat. We have only a few minutes left, so Dr. Khalid Hussein Miman, a warm welcome to you. Please tell us who you are, what you do, and then tell us a story from Teach to Reach 9, your Teach to Reach 9 story, something that had an impact on you, that changed you, perhaps helped you change something in your work. Dr. Khalid Hussein Miman, it sounds like your microphone is on, but we're not actually hearing you. So let's go. Charlotte and Dr. Khalid had actually requested permission to speak, so it's probably having trouble with the equipment, with the microphone. Charlotte, back to you as we continue. It's a funny thing. I think it sort of waxes and wanes. We had sessions that for a couple of years, I think this was during COVID, everyone had their equipment working really well because you didn't have a choice. It feels like we've sort of had some backsliding there. Back to you, Charlotte. Who shall we hear from next?
Well, I'm inviting Anu Loapo Raju Philip. Anu Loapo, are you able to unmute? Else we'll listen to Usman Mohammed Tukur. So you're first to unmute. Both your hands have been raised for quite a while.
All right. I think
if not, I'd like to consider also.
Here's Usman Mohammed Tukur.
Yeah,
hello.
All right, Anu.
Good afternoon.
Hi.
Hello.
Afternoon. So, ladies first. Ladies first, please.
Yes, please. How do you feel it?
Yeah, so Anu, warm welcome to you. Don't forget to introduce yourself. Remind us also when you joined the movement for Immunization Agenda 2030. And then share a story that had an impact for you from Teach to Reach 9.
Okay, good afternoon. My name is Anula Kwaji Philip from Nigeria. I work with United Nations volunteer, and also I'm health and safety environment personnel. Yes, I joined the Geneva Learning Foundation Immunization 2030 agenda. That was 2 years ago, and it has been a great experience for me and for my team. So concerning the Teach to Read 9, like the first question that I should, from my own experience, or what do I understand by Teach to Reach, I would say is a platform where I've relearned, and I'm learning and I'm unlearning. Then with a platform where we're able to share our experience with every other health worker from the globe. And from the Teach to Read 9, the HPV vaccine, the experience where the other people they have, like just like similar to COVID-19. When COVID-19 first came out, people were they were reluctant to accept it, and same thing is happening now. People are also reluctant to accept, especially the parents. So I think the way forward is to let people know, maybe proper awareness, and let people know the importance of the vaccine. And also I really appreciate everyone.
Thank you, Anu. Have we lost Anu now? It seems like.
Yeah, I can't hear Anu again, rather.
And again, at a particularly compelling moment, she was sharing her appreciation of everyone that Teach to Reach, I believe. All right, so we have some very interesting dialogue going on in the chat. Asia Sabine has seems to have okay from Karachi. Let's see if we can ask Asia to speak about. Seems to be very well informed about HPV vaccination on the global level. And then Lilian Mutua sharing about the lessons from causes of hesitancies. I'm struck by what I heard earlier, Charlotte, which is the notion that disinformation on social media has been a surprise for HPV vaccination advocates in Nigeria. Given what happened with COVID, it can hardly be a surprise, but that's for maybe. We hope we can get some perspective on that at Teach to Reach 10, if not before. We have, I see also Charles Chaskda, who has a hand raised. So we're happy to hear more from you. You might be our last speaker if you are able to speak to us. Let's see who else we have on the roster. So in our Zoom studio, we have those we call our guests of honor, and they are Teach to Reach participants who've distinguished themselves through an exceptional level of commitment and dedication, contributing to Teach to Reach 9. Charles Chaska, a warm welcome to you.
Thank you, sir. Good afternoon, everyone. I think I just want to lay my voice on the issue of the zero dose that we have been discussing. That is what caught my attention.
So first, don't forget to introduce yourself, Charles. Please introduce yourself and tell us when you joined the movement for Immunization Agenda 2030.
All right. Thank you. I'm Charles Chaskra from Nigeria, working with UNICEF. I joined the movement, I think, early 2021. That's when I joined the movement of Immunization Agenda towards 2030. So I've been following the Teach to Reach. For the last Teach to Reach 9, we had a series of discussion around the zero dose, which caught my attention, and even with the issue of the HPV. So thank God we are amongst the 11 states that implement HPV across Nigeria to introduce it into routine immunization. So I try to apply some of the lessons I learned based on our interaction during the Teach to Reach and into the campaign during that time of introduction. And it happens that our state happens to be one of the best states that achieve the desired coverage, even though they were insufficient vaccine to meet up with the 80% benchmark. But I think we are the first stage to reach 76% of the coverage within 6 days of implementation, even without sufficient vaccine. So the strategy we involve there is we tend to have a kind of one-on-one discussion with mostly the mama to mama support group, so that we equip them with the information we need them to discuss with the mothers and group of women, so that they can be able to pass the information to their girl child, even when somebody is trying to persuade them not to go for vaccination, but because they heard that cancer is something that is going to affect their lifetime, so they tend to come out to be vaccinated. And that helps us even to catch up with the routine immunization. That links to the zero dose approach, because we learned that even the zero dose we are talking about should not be limited to only people that are in hard to reach communities, but even within the urban settlements, we can still have zero dose. And we narrowed down our search during the vaccination to using the mama to mama support group to fish out those zero dose in within the household. When we go into the household to sensitize them, we ask them, this child, has ever been immunized? Even me, during my supportive surgery, we discovered a woman that said her child will not receive vaccination due to the past history with other children within the area. So she refused her children for vaccination. And those are some of the zero dose children. And they are just, I think, 2 kilometers away from the health facility. So I think this is a very good practice if we can adopt it in other states, I think it will be good to be having kind of discussion with the women support group so that we can be able to see what are their challenges and what are their fears so that we can guide them on how to go about it, and then we'll be able to achieve our desire by the year 2020, 2030 as expected. Thank you, and over.
Thank you, Charles. Before you go, I've got a follow-up question for you. I wasn't quite clear. So is it that you heard a practice or what was shared during the zero dose session is helping you with your work, or is it that you are simply describing the practices that you have that you would like to contribute?
Okay, yeah, I had a practice based on the discussions we had, the questions and answers we did during this zero dose session.
Right.
So, and I went and applied it on the field, which is to see whether it will work, which definitely it has worked, and it has helped us it has yielded results for us based on the coverage we have gotten at the end of the campaign.
Understood. Yeah. Thank you. Thank you, Charles. We haven't heard from very much from Asia and have heard nothing from Latin America. I know there's at least one leader of the movement for Immunization Agenda 2030 from Latin America who's in the room. So I suggest we close with GB Singh. A warm welcome to you. We'd love to hear, for the sake of time, we're going to ask you to be very concise with apologies, but would love to hear from you. Don't forget to introduce yourself and to tell us when you joined the movement for Immunization Agenda 2030.
Yeah, good evening, everyone. I am Dr. GB Singh. I have been State Immunization Officer for Punjab in India for almost 8 years. But my journey with immunization started in 2000 when I had joined WHO for polio eradication. And then in 2022, I retired as Director of Health Services for the state of Punjab. During this period, my experiences have been the introduction of MR has been one of the important experiences. Polio, of course, was entirely a different ball game. And then Punjab was the first state in the country to introduce HPV vaccination for the girls. So that which we did in the year 2016 rather. 2016 we had introduced the HPV vaccine, and Punjab there was a lot of enthusiasm across the country to see how the things unfolded, and we had introduced it in the two of our districts, but somehow due to many operational reasons we couldn't take the movement forward. Of course, we could immunize two batches at that time. But we have learned many lessons from that it is very important to involve everybody into the program so that we can take our movement forward. Similarly, for the introduction of MR also, that is measles and rubella, when we had conducted a campaign for MR introduction, the involvement of community, involvement of even the medicos, that was a challenge. And it took a lot of effort to introduce those vaccines. Other vaccine introduction, of course, that has been quite easy, and like for the pentavalent or for the rotavirus introduction or for IPV and all. But I must say that if we have to achieve our agenda for 2030, the IA 2030, the involvement of each and every individual, whether it is from the community or from the health systems or the children, so the teachers, the medical school teachers, so everybody needs to be involved for the achievement of our agenda. And of course, the public health people, they need to take a lead in this so that they are able to take this forward. So I have many experiences to share, but as you already said, that the paucity of time, so I won't be too long. But I must tell you that I am a retired Director of Health Services now, and I would like to get involved more. Somehow I haven't been able to participate too much in the Teach to Reach programs, but I think now I would be finding more time to participate in the programs, and I would be sharing more and more experiences during these meetings. Thank you so much.
Wonderful, thank you, Dr. GB Singh. Wonderful to have a senior leader who is now willing to share that experience with others across the world, and that is what Teach to Reach is all about. Whoever you are, whether you are whatever your level of seniority, whatever your level, the technical work, technical area that you work in, we all stand to gain from and to learn from each other. Again, a reminder, the date for Teach to Reach 10 has been set, Thursday, 14th of March. So we'll be doing the English on the 14th of March and French on the 15th of March. So we're now 124 days away from Teach to Reach 10. We'd like to end with a voice that is familiar to us because she has distinguished herself in the movement for immunization agenda. She is from Argentina. It's Maria Fernanda Monzon. Maria, a warm welcome to you. And we'd love to hear your Teach to Reach story, something that you experienced at Teach to Reach 9 that had an impact for you, for your work, for the children, boys and girls, men and women that you serve.
Hi all, thank you so much Rita and Charlotte. I'm from Corrientes, Argentina. I work in primary healthcare, and Argentina is very different from a lot of the other countries that we're participating. So every experience that you hear, it brings so much value to your work. I really enjoyed when people shared how HPV vaccination is going in other places, because here in Argentina, it's already been for over a decade. So our reality is very different. But the struggles and all the challenges that my colleagues are going through, they really they reinforce the idea that we are all working together for a better tomorrow for all of our kids and for all of the world. So I really enjoyed that. I had a chance to network, of course, and I've learned a lot of female genital schistosomiasis. That is not a disease that we have either, but that is very interesting, and that is obviously taking a toll on different countries. So I really enjoy that. I enjoy sharing and learning from everybody else. So thank you very much.
Thank you very much indeed, Maria. All right, wonderful. Thank you once again. Again, here today you heard only about immunization topics, but we also discussed neglected needs of women's health, and with experiences shared by practitioners from all over, from pretty much all francophone endemic countries where schistosomiasis is endemic and therefore FGS is an issue. 56 million women and girls affected by this disease, and the complexity around a neglected tropical disease that was also on the agenda at Teach to Reach 10 and then Teach to Reach 9, and then remember that the health impact for local communities on the front lines of climate change was also at the top of the agenda. Last July we held an event with 4,700 health professionals who expressed grave concerns, saying climate change is already a threat to the health of the community that I serve. So those were some of the other topics. Outside of immunization, we also launched a call to join the movement for immunization. That's it for this Insights Live. A lot going in the chat. Many messages, of course. I've been sharing some of them, so apologies to all those of you who shared great messages and we haven't been able to share, but there'll be many more opportunities. If you have connectivity issues, a little tip is to go and subscribe to the Foundation's podcast. You just type in your name here, your email there, and you'll receive the links to access the different podcasts, so you can actually listen to the audio-only content. It's like radio, but so a lot less costly in terms of bundles. That's it. Thank you, Charlotte, of course, and to all of you, our guests of honor and contributors to Teach to Reach. Wonderful to have you here today. Take care. And for Asia, unfortunately, we are over time. We did call on you, but you did not respond at the time. Apologies for that. wonderful to hear. We only heard a few, of course, in these events of the voices, but that's the point of when we ask you to teach to reach questions, or when we ask you to follow up in various ways. Well, this is where you can, every person can have a voice, as you'll be seeing in the compendium once it is issued. Wonderful. Take care and goodbye.